Hi, I'm Dr. Ed Jacobs, the founder of Impact Therapy, and I'm here with Dr. Chris Schimmel. And she and I have been doing workshops together for, the last 20 years. And there's a number of people that are doing workshops throughout the U.S., and Dr. Danny Beaulieu is actually doing workshops throughout the world. She goes all over. Dr. Nina Spadera does some work out of Salt Lake City, and she's now with Walden University. So she's trying to introduce some of the concepts of impact therapy to the students of Walden. Dr. Bob Rubenstein out of Marshall University is doing a lot of work. Dr. Tori Stone, who can be seen on some of these YouTube clips, she's doing some. But Chris and I do the most workshops. We've done probably
100.
200 or 300.
Yeah.
Well, tell a little bit about how you got connected to impact therapy, and then.
Well, I came as a student to WVU several years ago and was introduced to impact therapy in Ed's counseling techniques class, actually, and went on to use those techniques in private practice, but more importantly, used them in school counseling and in in-home therapy settings with adjudicated youth.
I remember when you called me about the creative techniques, and
my first day as an elementary school counselor, and saying, I don't know how elementary school counselors do this without using creative multisensory techniques. So yeah, I think I first wandered into your class in the spring of 1992, and so I've been integrated into this approach for over 20 years.
What are your thoughts just on, a lot of people will say that impact therapy moves too fast, or we tell students, what do you teach your students about the speed of impact therapy?
Well, I teach them that you should go as quickly as you can, but certainly you never want to go more quickly than the client is able to go. So, at the end of the day, having a good relationship with your client is key. But what we find is that a lot of clients come wanting help immediately, and impact therapy really gives the counselor permission to move as quickly as the client can move.
Yeah, that's what I said, because a lot of people will ask us that question, and we always say, you move as fast as you can move.
Right.
And we're not advocating speed, but what we know is a lot of people in this day and age, if you go that very slow, sort of Carl Rogers, very slow, take the first 2 sessions to build rapport, a lot of clients won't come back.
Especially with kids, because kids are so accustomed to, being engaged with something like an Xbox or Nintendo or some kind of media such as that. So I teach my students, you've got to be at least as interesting as Xbox and MTV and all that media that they're engaged with Facebook. You've got to be that engaging or you lose their attention. So yeah, we're not advocating speed as much as we're advocating help.
Right.
And be engaging.
We have a number of clips of YouTube on YouTube now, and you can go to impacttherapy.com for more information about impact therapy.